Rosa is a 65-year-old woman with an 8-year history of congestive heart failure secondary to an anterior wall myocardial infarction. Shortly after her recovery, she had a 4-vessel coronary artery bypass graft performed. In addition to her prescription medication, she takes aspirin 81 milligrams daily to prevent reinfarction. Rosa has seen her physician today and brings in renewal prescription for digoxin and captopril. Her condition worsened enough that she had to cancel her June trip to Disneyland with her grandchildren.
Good morning, Ma'am Rosa. Can you hear me?
Yes, I can hear you.
Again, good morning, Ma'am Rosa. I'm Bon. I'll be your pharmacist for today. How are you doing, ma'am?
I'm doing fine. How about you, dear?
I'm doing fine as well. Thank you for asking. I reviewed your prescription from Dr. Ames, and you have 6 refills, which you have accumulated 2 refills already. Before we start, I would like to ask for a little bit of your time, maybe 5 to 10 minutes, just to make sure that you understand what medications you are taking, when and how to take it, and other important informations that needs to be remembered. You can ask whatever questions you have in mind regarding your medication. Is that all right, ma'am?
Sure, dear. I'm not in a hurry.
Okay. I would just like to clarify if the information that I have here of you is correct. Is that all right?
Sure, dear.
Okay. Do you still live in 4212 W Mission Lane, Albuquerque?
Yes, that's correct. 4 to 1.
Okay. Do you have drug allergies that you know?
I got no drug allergy.
Okay. Are you taking any medications?
Yes, I'm currently taking aspirin. The doctor said that it is for my maintenance to prevent me from having a heart attack.
Okay, I see here that you had a coronary artery bypass graft after your recovery from a heart failure. Are you taking any other OTC drugs?
OTC drugs? No, dear, no.
Okay, thank you for answering my questions. All right, Ma'am Rosa Hodge, your age is 65 years old, and you have a 8-year history of congestive heart failure secondary to an anterior wall myocardial infarction. And as I've mentioned earlier, you underwent a 4-vessel coronary artery bypass graft. So Dr. Ames this prescribed you with digoxin and captopril. Am I correct, ma'am?
Digoxin, yes, that's correct. Seems that the old medication that I have, which is nifedipine, is not working well with me.
Yes, Dr. Ames switched your nifedipine to captopril. Since you have been taking this medication lately, I will ask questions regarding your medication. Is that okay?
Go ahead, dear.
All right, let's continue. May I know what medication is this? Can you see it?
Yes, I can see. That's that's digoxin, my heart pill.
All right, yes, that's correct. Do you know what this is for?
That's my heart pill, dear.
Yes, that's correct. Do you know how to take it?
I take it once a day in
Mm-hmm.
the morning.
Mm-hmm. Do you encounter any problems while taking digoxin?
None, dear. I'm doing great.
All right, Ma'am Rosa. Your answer when I ask you how to take it is not what Dr. Ames prescribed.
Oh, really, dear? How so?
Okay, digoxin is to be taken 1 tablet every morning on Saturday, Monday, Wednesday, and Friday. For the rest of the days, which are Sunday, Tuesday, and Thursday, will be taken with 2 tablets every morning.
Oh, I didn't notice that. I thought it's just once every morning, dear. I'm sorry.
Oh, it's all right, ma'am. It's all right. The next time you'll take digoxin, please follow what Dr. Ames prescribed for you. Also, store this medication at room temperature.
Room temperature. I will take note of that.
Okay, all right, all right. We are done with digoxin. Now let's proceed to your next medication. May I know what is this?
Oh, that's captopril. That's also for my heart, dear.
Yes, that's right again. How do you take it, ma'am?
Uh, 2 to 3 times a day.
What kind of problems are you having with it?
None, my dear.
Okay, Ma'am Rosa. For captopril, you will take 2 tablets for 3 times a day, preferably 1 to 2 hours before your meal. And just like digoxin, you will store also this at room temperature.
Oh, okay, dear. May I ask what kind of problems could this medicine cause?
Oh, sure, ma'am. Sure, ma'am. Captopril has side effects of dizziness, lightheadedness, and loss of taste. Have you experienced any of that?
Oh yes, captopril made me feel funny when
Mm.
I first took it.
Oh, can you tell me what you have experienced?
Oh yes, dear. I feel really dizzy, which started about 24 hours after I started
Mm-hmm.
taking it. It was
Mm-hmm.
bad enough that I saw spots and almost fell. It happened
Oh,
primarily when I got up out of bed or from a chair.
oh, I'm sorry to hear that, ma'am. May I know what you did after that?
Uh, I tried getting up slowly and it helped
Mm-hmm.
some. So I stopped it for a day and it went away. Then I started back at one pill twice a day for a couple
Okay.
of weeks. I'm back
Mm-hmm.
up to one pill 3 times a day and I'm not having any problems. I'm going
Mm-hmm.
to
Mm-hmm.
try slowly increase it to what the doctor prescribed me to take. I meant to ask her about it, but I forgot to mention to Dr. Ames, dear.
Captopril can cause dizziness or lightheadedness, which can occur when your body is still adjusting to the medication. Ma'am Rosa, take captopril as it is. If ever this will happen to you again, you can sit or lie down for you to be comfortable. Also, no worries, ma'am. I can give Dr. Ames a call after our appointment to raise your concern about it. Have you noticed anything after taking it for a while?
Um, I haven't noticed anything else except this
Mm-hmm.
new medicine seems to be working better than the other. I've got lots of energy and I can make that 6 block walk to the store without getting winded.
That's good to hear, Ma'am Rosa. With your medication right now, maintaining a proper diet and exercise is recommended. Eat foods like vegetables, fruits, fish, poultry, or anything that is low in sodium. You can do simple exercise like walking every morning to keep your body flowing, to keep your blood flowing and body healthy.
Oh, okay. Okay, dear, don't worry. I love my greens and walks in the morning.
That's good to hear, ma'am. Before we end this appointment, may I ask you to repeat what you have remembered about your medication just to make sure that you understand it right?
Oh, all right. I will try my best to remember it, dear. Um,
Take your time, ma'am Rosa.
I will take one digoxin every morning on Saturday, Monday,
Mm-hmm.
Wednesday, and Friday.
All right.
The rest of the days will be 2 tablets every
Yes.
morning.
Yes, ma'am. You remember it correctly so far. How about for captopril?
For captopril, I will take 2 tablets every before a meal, which
Mm-hmm.
will be 3 times a day. If I feel dizzy, I will sit or lie down and just continue to take as it is. I will
Mm-hmm.
continue to watch my diet and, of course, exercise.
You are absolutely right, Ma'am Rosa. Can I ask for an email of your companion? Because I will be sending you your personalized medicine guide list via email for you to easily understand and remember how to take it.
Oh, email. Okay.
Yes.
Give me a minute. I'll ask her. Diane Marie, my pharmacist is asking for your email because she is sending me a guide list of my medications. Can I have your email? Email, yes, email. Oh, okay. Here is the email of my companion.
Okay, ma'am.
Okay, sent. I already sent it.
All right. It's dianemarie123@gmail.com. Did I get it right, ma'am?
Yes. You get it right.
All
You
right.
got it right.
Noted, ma'am. You may also inform and ask for assistance from your companion who is with you to remind and guide you in taking the medications. Is there any questions or concern you would like to ask before we end our call?
I think I am alright, dear.
All right. If ever you will experience unusual symptoms, don't hesitate to contact me or your physician to address such problem. If your medications are getting low and insufficient, just call us so we can prepare your medications for you.
Oh, thank you, my dear. Thank you.
You're welcome, Mom Rosa. Have a nice day.
Have a
Have a
nice
nice day,
day
ma'am.
too. Thank you.
All right, ma'am. Okay, now to consult Mom Rosa's physician. I must call her now. Hello, good morning, Dr. Ames. This is Bon, Mom Rosa's pharmacist.
Hello, Bon. How may I help you?
I just finished my pharmaceutical consultation with Mom Rosa about her newly prescribed medications. She is 65-year-old female with 8-year history of congestive heart failure secondary to an anterior myocardial infarction. She had a 4-vessel coronary artery bypass shortly after her recovery. She is also taking 81 milligrams of aspirin daily and preventing reinfarction. You prescribed to her, Dr. Ames, digoxin 0.125 milligrams to be taken with 1 tablet every morning on Saturdays, Monday, Wednesdays, and Fridays. And for the rest of the days will be 2 tablets every morning. For captopril, you prescribed 25 milligrams to be taken 2 tablets 3 times a day.
Yes, I remember her. What seems to be the problem, Bon?
Doc, I called today to address possible drug interactions. I've noticed that there is one serious drug interaction and 3 drug interaction that needs to be monitored. First, the aspirin and captopril have a serious drug interaction. Co-administration may result to a significant decrease in renal failure, since NSAIDs may diminish the antihypertensive effect of ACE inhibitors. The second one is captopril has a drug interaction with both digoxin and aspirin. Captopril and digoxin, when taken together, can increase the levels of digoxin in the body, which can result to digoxin toxicity. While co-administration of captopril and aspirin may either increase toxicity of the other or may reduce the kidney function, particularly in elderly or volume depleted individuals. Lastly, the aspirin and digoxin, when taken together, can increase the potassium levels in the blood. When there is an increase of potassium levels, the heart may beat irregularly, which in the worst case scenario can cause heart attack to Ma'am Rosa.
Oh, I see. Thank you so much for noting and informing me about this, Miss Bon. Are there any other concerns?
Yes, also Doc, Ma'am Rosa experienced dizziness when she took captopril for the first time. According to her, it happened when she got up from bed or from a chair. She said that she saw spots and almost fell.
Yes, that's a very common side effect of captopril, right? She just
Yes.
needs to get up slowly to prevent feeling dizzy or lightheadedness from happening.
Yes, Doc. Yes, Doc.
What can you recommend to prevent the drug interactions, Miss Bon?
My recommendation will be switching her aspirin 81 milligrams to clopidogrel 75 milligrams, in which it is better This will also eliminate the serious interaction of aspirin with both digoxin and captopril. This will be taken for once daily, preferably before meals in the morning. Thus, this also has a side effect of dizziness, same with captopril.
Okay, noted. How about the digoxin and captopril?
Okay, with regards to the digoxin, Dr. Ames, we could give her the same dose of 0.125 milligrams, but the schedule will be once per day only every day. This will be taken preferably after breakfast. As per ACCF AHA guidelines, a loading dose to initiate digoxin therapy in patients with heart failure is not necessary. Moreover, for the captopril, we could provide the patient with an initial dose of 6.25 milligrams and gradually increase it as it is needed. It will be taken twice daily instead of thrice, 1 hour before lunch and dinner, respectively, because it should be taken with an empty stomach. The proposed and recommended schedules of co-administration and lowering the dose will reduce the adverse effect, and also this avoids the risk of drug interaction.
Okay, thank you for your recommendations, Ms. Bon. Pharmacists like you really have a great contribution in maximizing patient outcomes, especially since pharmacists are the medication experts. Your recommendations will really help lessen or better avoid interactions between drugs and the adverse effects that may cause harm and health complications to our patient, Ms. Rosa. All recommendation will be noted for Mom Rosa's prescription. Again, thank you, Ms. Bon.
You're welcome, Doc Ames. Have a nice day.
Thank you. You too.